are we upset with people in a wheelchair for having to sit down all day? Like my motto is, let's treat a human being like a human being, and every human being is different. And it doesn't matter if it's your background, your sex, your gender, your neurotype, none of that matters. If we just speak to the human being in front of us and how it is that they can be a good contributing member of our team.
Hello, 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 everyone. Thank you so much for tuning into this episode. You're really in for a great episode with this one. I was joined by Ron Sosa, who, if you don't know who he is, you should. Executive Director of the Uncharted Veterinary Conference and Chief Neural Officer of Syn-APT, which we talk about a lot in this episode, which is a leadership initiative that kind of helps us rethink how we lead and make sure that we're leading in an inclusive way. So we'll talk a lot more about that in this episode. Personally, I didn't grow up thinking of myself as neurodivergent, but I also didn't have the language to describe some of the ways that I knew my brain worked a little bit differently. However, learning more about myself and my own flavor of neurodivergence has made a huge difference in my life, not just personally, but professionally too. So we each talk about our own journeys and what inclusivity in the workplace really means and how even small changes can go such a long way in supporting everyone on the team. Things that we don't always think about, like sensitivity to noise or needing extra time to process information or finding traditional staff meetings overwhelming. These things might not be obvious, but they're real, and understanding them helps create spaces where everyone on the team can thrive. Like I said, today's guest is Ron Sosa, certified veterinary practice manager, neuroinclusive leadership coach, and someone with over 25 years of hands-on experience in veterinary medicine, from being a client service representative all the way up to a multi-hospital owner. As I said before, he founded and is the chief neural officer for Syn-APT, an initiative that helps veterinary leaders rethink how they lead with intention, with authenticity, sustainability, and focuses especially on those who think, process, and communicate a little differently. Ron also serves as the executive director of the Uncharted Veterinary Conference, where he leads international programs that support veterinary professionals in tackling leadership, culture, and communication challenges in modern practice life. Whether he's coaching, speaking, or facilitating, Ron's work is rooted in empathy, curiosity, and the belief that true innovation starts with understanding how people work best, especially in a system that may not have been built for them. Like I said, you're in for a great episode with this one. I'm so glad you tuned in. Let's go ahead and get into it.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serraline Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serraline belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimpericatRioDVM.com for full prescribing information.
Ron, I'm super excited to have you on the podcast, Executive Director of the Uncharted Veterinary Conference, and then neurodivergent leadership coaching. So I'm really excited to dive into a lot about that.
Yeah, I'm excited to talk about it. Where do you want to start?
Let's start with your company.
Mhm.
You're a neuro-inclusive leadership coach. So can you talk a little bit about neurodivergence, neuro-inclusivity, and why talking about neuro-inclusive leadership is important?
Yeah, I think that answer involves giving a little bit of background about my story a little bit. I got late diagnosed in my late 20s with ADHD. I kind of went down this rabbit hole of like, oh, that's how my brain functions. That's why I have a low level of tolerance. This is why, things just started to make sense in my life. And then pandemic hit in 2020, and towards the end of 2020, I realized like my own mental health was draining, and I went back into therapy again and trying to figure out like how do I recope with the world. And I came out with a tentative ASD diagnosis. And so what it turned out to be was autistic burnout, which I had no idea at the time, rather than, depression or anxiety or any of those things. And it's just like it's finding out who you are for the first time. Like you go into the next rabbit hole of to be honest with you. I started off going, this doctor's a quack and I'm going to prove him wrong.
Sure.
But I go down this rabbit hole of like learning about autism and how it presents because in my head I had a completely different avatar of who I am versus, what I thought it to be. And it's like between the ADHD and between the autism diagnosis, I've really just discovered who I was for the first time at like 36 years old when it happened. And it turns out 2 years later, I finally got up the courage to quote unquote come out to my father and be like, hey, I got this diagnosis. And he's like, oh, yeah, you got that when you were 3. And then he thought the doctor was a quack. So he just kind of went to a different therapist. And so, yeah, that was interesting. So I think that my story is the reason why I'm so passionate about doing the leadership coaching that I'm doing now is because when I started as a new practice manager, I had such low level of frustration. Everyone around me thought I had anger issues. I became the boss or the leader that I never wanted to be. And I wanted to be the leader that I always wanted to have. And so it was really important for me to kind of pull back after I got my diagnosis and go, how can I help leaders who were in my shoes, not fall down the same pitfalls that I fell down? And that's really the passion and the purpose behind the coaching that I do is one, help the neurodivergent leader. So whether they know they're diagnosed or not, like their struggles are very similar. Or are you somebody who really wants an inclusive culture and wants to learn more about how to lead in a way that can support their team because they have no idea how?
And I love that we're talking about this. And I'm really interested in diving into some of the ways that we can create inclusive environments in that way. My story, different but similar, also was diagnosed in my 30s and with ADHD. I can very much relate to your story of going down the rabbit hole of symptoms and really it just being this journey of self-discovery where so many things that had frustrated me for so much of my life that I just felt like I just didn't have enough willpower to do it better. All of
Uh,
a sudden, didn't they? They looked much different. It just looked like, oh, it's my brain just works a little bit differently, and
mhm.
so I'm not gonna approach this in the same way. I'm gonna approach it differently. Even still, even having had that experience myself and having no doubt in my mind that getting the diagnosis and discovering these things about myself has been beneficial and that there are differences that can make normal workflows and things a little bit challenging. Still, sometimes I still have that insecurity of like, is it just me? Do I just not have enough willpower to do this? And so not to, make this all about my story or anything like that, but kind of bringing it back around to what does a neuro inclusive or just an inclusive environment look like? Because man, there are things in typical workflows that I find really challenging, and the idea of adjustments in the workplace to help combat some of those challenges, I don't know, it seems like too good to be true.
Yeah. Oh gosh, this is a great question, and I'd love to unpack it. So I think that this is really where neurodivergent people like you and I, like we put on the mask and we compare ourselves to the conformity of society. And we say we are not doing good enough or well enough or, the same way as other people because I shouldn't feel like I'm burning out just because I'm doing it the way that someone else is doing it. And so that's the mask that we wear. We're constantly trying to fit into systems to make ourselves, sort of invisible and lose our own identity to make sure that we fit in and conform with society and how they is expected to appear and sound and act like in our own practices, in our own lives. That's such a big part of unmasking is realizing we don't need to shame and blame ourselves for not conforming with society. We can still function. The way we function is going to look different, and we can't shame and blame ourselves for that. And we can build awareness for those around us to understand where we're coming from. One of the most extreme examples I give is when people complain about accommodations or it's not fair that we're making these concessions for a team member who needs more breaks. And my more severe reaction is, are we upset with people in a wheelchair for having to sit down all day? Like, is that fair for somebody in a wheelchair to sit down all day? And all of a sudden, I think it starts to click. It's like, okay, I can be at the same base level of effort and energy management as the rest of the people on the team. Getting an accommodation is really just a level set the energy management that we put into coming to work and we put into the everyday tasks that we do.
I think that's such an important message. And I love your example there. Like what you said was not, do we get upset with the person in the wheelchair because we have to make accommodations? What you said was,
Yeah.
do we get upset with them because they sit down all the time? Like those are two very different statements. And I think it's a really powerful image. I remember doing we did a recording, it was a while back, and we talked about menopause. And I remember
Mhm.
Dr. Liz, and she talked about this really affecting women when we're in the prime of our career. Kind of kids get old enough, they're starting to handle themselves, we're getting our autonomy back, and then wham, like, there's this big change. And so, she talked about adding more breaks and changing uniforms to help, be more comfortable. And kind of the same conversation in talking about accommodation. She said, well, if you have to have that doctor see one or two less appointments each day because they need more breaks, isn't that better to see one or two less appointments each day and keep them for 10 extra years rather than say, no, we have to have you do everything like everyone else, and then they don't stick around?
I 1,000% agree with that. There's one thing I want to say is kind of going backwards slightly is women are not diagnosed as easily as boys, right? So when we look at the DSM and the criteria for getting a diagnosis or even recognizing what is going on, all we have is the 3 to 5 year old white male avatar to look at. And I would hope with all the research that's being done, we have gotten better, but we're still not quite there. And so the two times that women tend to get a diagnosis are when they have given birth and their child, they notice something is wrong with their child. And then it's like, oh, this is a genetic thing. And let me get tested because I'm experiencing the same thing, only I've quote unquote masked and made it look like it's not. Or when they hit perimenopause and that decrease in estrogen completely throws away all of your masking abilities, everything seems 10 times harder than it used to be. And now you can't function the same way you used to. And so those are the two times in life that women are most diagnosed correctly with a neurodivergence instead of, major depressive disorder or an anxiety disorder.
You're definitely telling my story there where, yeah, it was my daughter, and I saw her and I went, you are exactly like me. And I noticed some things. And I've learned that as well, that women tend to get diagnosed much, much later in life compared to men. And that was going to be my question, which I think you spoke to a little bit. Do you think that's improving? Are we doing a better job looking for it in women?
I think we are getting better. I don't think that we're really there yet. I think that there's a fear in our human medical society that we're overdiagnosing, or maybe the populist opinion that we are overdiagnosing. And I think the real opinion is for me that we're catching up to the diagnoses that should have been there 20, 30, 40 years ago. So I don't think the percentage of the population has changed. I think the percentage of diagnosis is starting to match the percentage of population who truly has neurodivergence. Because there's a lot of opinions out there that maybe we're overdiagnosing and medications are on back order and maybe we need to slow that down. And I don't think so. We are seeking diagnosis because there's supports in our lives that we are missing.
Right, right, absolutely. Well, and yeah, and speaking, as someone else who diagnosed much later, I was this way 30 years ago, and so it was definitely around.
Yeah. Yeah.
Uh,
And like, women who are quote unquote not hyperactive, well, they are in different ways. They are
mhm.
more hyperactive in their head. They're more reserved in their hyperactivity. So it might be the constant twirling of your hair that you can't stop doing, or that stimming. Like there's a hyperactivity that's happening, maybe if that's your neurotype, that is happening outside of just running around as we think of the boy. And then most women are inattentive type, and so that just presents differently. And when we look at societal pressures for women to conform and be more proper and wear certain clothes and act a certain way and play with certain toys, there's a lot more pressure to conform and to mask who we are and who they are as a woman or as a girl that they oftentimes misdiagnose.
Sure, sure, absolutely. I've also heard it described as racing thoughts, which
Mhm.
I was stressed out about something. My husband asked me about it, and I was like, "Well, I think about this, but then if this happens, what about this? And then it could lead to this and this." He's like, "Is this how your brain works all the time?" I said, "Yeah, I think
Yeah.
so. Does yours not?"
Yeah. Our brains are actually more conditioned to look for the negative than the positive.
Sure,
So we have to
sure.
do even more work to keep a positive mindset.
Yes. And so I want to talk about some of the words that I've heard you use. We're using some terminology here, and
Yeah.
I I've listened to you talk about this a little bit before, and you're just so good at using the terminology in a way that really has made sense to me, who honestly is much less familiar. So we're talking about neurodivergence. You've talked about masking, stimming, things along those lines. Can we jump into some of the words to be aware of around neurodivergence?
Yeah, masking is a big one, and it's like an invisible labor of editing exactly who you are to fit into the environments that are around you because they're not built with our brains and minds, right? So it is us rehearsing every small email before we send it out. It's over analyzing everyone's tone around us to make sure that we're interpreting it correctly. It's hiding our stims. So if you're somebody who has verbal stims, maybe you're turning that into a hidden stim. So like mine was biting my cheek because I would always get in trouble for being the vocal kid in school. So I bit my cheek, and that was my stimming. I probably have scars inside that no one will see. It's suppressing our sensory needs. Like I am a person when I would go into the clinic in the mornings, like turn out all the lights, but it's going into those harsh conditions and just telling ourselves it's fine, it's fine, it's fine. And that's the mask that we wear. And it's exhausting. And unfortunate part about masking for so long and being late diagnosed is that it really erodes and erases our identity of who we are. So somebody who is late diagnosed like myself, and I don't know if you can relate to this, is we wake up one day, we get a diagnosis, and then you're like, I actually have no idea what my favorite movie is. I have no idea what my favorite color is because I've picked the things that made me sound normal or to fit into the group I was talking to. And so that's why a lot of the coaching I do is really unwrapping and taking that mask off to find out who it is, who we are on the inside. Because oftentimes we have no idea. We've done service for others for so long. We've been what other people needed us to be for so long. That's the mask that we wear, that we actually lose our whole identity.
Oh man, Ron, you're really wanting me making me want to explore this coaching. I'm like, what is my favorite movie? I mean, I will tell you what my favorite movie is, but now I'm questioning it. I'm like, is that my favorite movie?
Yeah.
It's Sandlot, by the
Um,
way.
I love the Sandlot.
So good.
You're
Ah,
killing me, Sauce. Uh,
yes.
yeah. So also, I think you asked me about stimming, and stimming is it's a repetitive behavior that helps calm our nervous system. So what you'll see is some younger kids, and when we think about autism, we think about hand flapping. Sometimes this is humming. It's making a sound. It's clicking our pen over and over and over again. It's that repetitive thing that helps actually soothe our nervous system. We don't even realize we're doing it to soothe ourselves. Like I have a 10-year-old boy who his stimming is just these verbal crazy sounds over and over and over. I've got women who have suppressed their stims that depict their cuticles, right? That is their stim. It helps like calm that nervous energy in a way it focuses it and does something different. And it's a repetitive action.
You mean like this hair tie that I've been twisting and untwisting the whole time we've been talking?
Yeah, the fidget spinners are great ways to
Yes.
help us stim and help us focus on what it is we're doing. I'm holding like the infinity cube. I love an infinity cube, although it clacks and I'm a little sound sensitive, so I hate the clacking.
Ah,
But but yeah, it's those fidget things that help us do a repetitive action and calm ourselves down.
that's really helpful to kind of, there's so many behaviors that I think people who are neurodivergent that we do without realizing what they are. And just like it can be really therapeutic to put a name to, your particular flavor of neurodivergence, putting a name to some of the other things that we do, especially without even realizing that we're doing them, I think it offers a lot of clarity and it just kind of it makes I don't know, it makes it feel a little more normal seems like the wrong word, but that's sort of what it feels like.
It allows us to be seen and heard and
Yeah.
validated for our own experiences.
There were some other words that we were talking about, executive dysfunction, and that was a really
Yes.
eye-opening conversation when I spoke to you last.
Yeah, I think of executive dysfunction for my science nerds and most of our veterinarians out there. It's the activation energy to do a task. So you need this energy push in order for the boulder to go up the hill, or in order to, get the action to completion. Our activation energy is different. And so it is driven by novelty, it can be driven by urgency, it can be driven by interest. So it's just a different operating system for our nervous system to respond to the world. And so oftentimes executive dysfunction, so dysregulation of our executive function, looks like having a hard time initiating a task, having an understanding of the passage of time around us. So this is the person who's probably always late to work, even though they feel like they leave on time, or they just can't figure out how to leave on time. Our sense of time awareness is broken if you consider the normal neurotype in the world. I oftentimes think about time blindness, which is a part of executive dysfunction. We have all experienced it at some point, driven home from your commute, and you're like, how in the world did I get home? I don't remember anything. That is just a form of time blindness, which is a form of executive functioning dysfunction. And so we have a harder time regulating that. And so oftentimes it will look like we are procrastinating or we're lazy. And to me, I really like to define the difference between executive function, laziness, and procrastination. So are you ready for my definitions?
Yes, yes, let's hear them.
Yeah. All right. So lazy, one chooses not to do the task and you're okay with it. You're fine with it. You don't care if it gets done or you expect someone else to do it. You just don't care, right? You don't want to do it and you don't care about it. Procrastination. You desire to complete a task, but you delay it because you have perceived it as either challenging, boring, or it's too time consuming. You don't derive satisfaction from it. So therefore you put it off until later and you're okay putting it off till later. This is oftentimes like me in college where I didn't want to write my paper and I'm like, I
Hmm.
know I can do it the day before. I'm okay with that. Executive dysfunction says, I want to do the task. I want to tackle the task immediately without significant obstacles, but I experience a difficulty doing it. So my brain struggles with like activity transitions. So this shows up for me sometimes with as simple as showering and brushing my teeth in the morning. I can wake up from bed, the alarm goes off, and I'll be yelling at myself, just get up and brush your teeth. Get up and, get in the shower. And there's it's the energy to do that oftentimes is not there because it's not novel, it's not urgent, and I have no interest in doing the thing.
Sure. I can relate to so much of that, particularly the time blindness and activity transitions. Oh my gosh, can we talk about activity transitions? Because when I learned
Yes.
about this as a characteristic of ADHD, I was like, this makes me feel so seen because I was just ready to scream with being told, okay, well, yeah, you have these meetings, but you've got these 20-minute blocks in between. Just work on something a little bit here, a little bit here. And
Mhm.
I just couldn't do it. I just can't do it. I want to say, yes, I can because I'm strong but no, it does nothing gets done.
Yeah.
And when I learned about transitions being a challenge, I went, oh, yes, so much so.
Yeah. So if I asked you to put your hand on a burning hot stove, would you do it?
I would not. No.
Right? Your brain actually stops you and says, danger, you can't do it. I'm going to override your autonomy and I'm going to pull your hand away because it's too hot. It's sort of the same thing. The brain completely shuts off our ability to do the task. And so task switching or transitions are really hard as well because there's like this expectation of preparation that didn't happen. I often see this in the vet clinic when we have a doctor who's doing surgeries for the morning and then transitioning to appointments in the afternoon. And so some of our neurodivergent folks have that hard time transitioning from one to another because there's all of these tasks in our head that have to get done for this part of the work. And now I have to transition over there. And it feels like a rejection for what it is we're supposed to do, which then leads to a whole emotional breakdown. It can lead to us shutting down. It can lead to a lot of things, and it looks like different. It sometimes will make us appear lazy because it's like we didn't finish any of these things because this is now what we have to think about over here. And that out of sight, out of mind object permanence of whatever I had to do for surgery is gone. So I don't remember to clean the surgical packs. I didn't remember to, throw the laundry in the hamper, whatever it looks like. All of a sudden, you get quote unquote lazy team members because that transition either took a lot of activation energy out of them, so not enough spoons for spoon theory. So it took all their spoons to transition, or it's out of sight, out of mind.
Okay, here we are getting to more terminology. I spoon theory. That's a new one for me.
Yeah. So I think spoon theory derived, I could be wrong. I'm going to say this, so somebody will probably correct me. But spoon theory derived, I think, from chronic pain management. So people who have chronic pain, how much energy can you put out into the world based on your chronic pain? Can you spend? So do I wake up with 12 spoons today and brushing my teeth costs me three, and taking a shower costs me five, and just going to work, like I have no more energy to give you and I'm going to show up disengaged,
Why
right?
spoons?
Or it's the way I think to
Sure.
visualize and turn it into an analogy.
That makes
Or I
sense.
could wake up today with 25 spoons and guess what? Brushing my teeth cost me one. It's a completely different system every single day.
That feels like such a human condition of just
Yeah.
waking up with different ability to give each day. And it's just going to vary from one day to the next based on so many different things.
Yeah. So many different factors.
So when we do have people who struggle with that task switching and it may manifest as what appears to be laziness, how can we support those team members?
I think we've got to bring awareness to not asking a fish to climb a tree, right? If we know we have somebody who has a pattern of behavior who, quote unquote, looks lazy because they are constantly the person that has to switch from surgery to appointments and they can't do the thing, why are we going to push them harder to do the thing? So, is there a way that we can keep them in surgery or a post-op patient care position, or can we put them in a position where they can complete their goal of that role before they transition? Because that's oftentimes like I haven't been able to complete the thing, or I haven't been satisfied enough with what I'm doing, or like can we work around that and work with people's strengths? So this is where the neuroinclusive part is. Accessibility says let's work with people's strengths and not just chronically whip them for their weaknesses.
Absolutely. No, that makes sense. And supporting people and, goodness knows how hard it is to get somebody who will come in and do the job and do the job well and fit in with the team and all of this. So, why would we discard someone who is doing all of those things over the fact that they need to do them in a different way from the people around
Mhm.
them?
And just because Sally can do surgery, clean up after herself, and do appointments doesn't mean everybody is Sally, right? And maybe Sally is going to burn out from doing all of those things. And we need to talk to Sally about how much energy it takes her to do that and to make it look good. So, is that something we should be expecting at top level 10 out of 10 every single day? Because I think that leads to burnout just as much.
Yeah, you're absolutely right. Yes, you're right. Sally probably needs a conversation as well. And then, kind of to your point, recognizing that if someone else can't function to the level that Sally is and pull all those things off, it's not, browbeating and saying, just do it. You just do it better. Gosh, like I am here to tell you it does not work because of that executive dysfunction. I physically cannot. I had
Yeah.
a podcast introduction I had to record, and I had a very clear moment of executive dysfunction where I stared at that thing for longer than I will admit on this podcast. And I ended up saying, I can't do this today. Like
Yeah.
I cannot do it today. I will not, I cannot engage in this and I can try to do other things, but this one's not happening. And so instead of saying, well, no more podcasts for you. Thank goodness that wasn't the answer. It was okay. Well, can you carve out time at this time tomorrow and we'll do it then and
Yeah.
adjusting and making it work.
Yeah. So the spoon theory says doing the podcast cost you too many spoons and you were in a deficit. So therefore you
Right.
can't spend the spoons.
So much clarity happening in this conversation right now. So certainly, as we've sort of talked about, maybe when we were kids and definitely much more recently as well, there's been quite a stigma around neurodivergence, around mental health. Where do you feel like we are in terms of just the conversation around neurodivergence?
There is a newfound awareness around neurodivergence, and I think I don't know if we have TikTok to thank for this or all the reels that go around, but there's a lot more informative people out there giving their firsthand experience on how they experience the world. So I think that there's a bit more awareness than there ever has been around neurodivergence, but I still think that leaders whether they are unaware of their own diagnosis or maybe they're in a neurotypical, they still don't know what to do with that information. They still cannot comprehend and figure out how to implement around inclusion. So when I give talks, one of the big things I talk about are, for me, don't give me the hour lunch. I will work efficiently and well the first half of the day. I will take my lunch for an hour and I will be completely dead and disengaged when I come back. Like I will give all that I have, but the spoons are gone. Like for me, hour lunch takes a lot of my spoons. Give me 6 10-minute breaks during the day and I will be an efficient and I will be good and I will be proud of the work that I do all day long. And still what I hear is, but what about the rest of the team? If I give everybody 6 10-minute breaks, well, wouldn't that be chaos? And I'm like, well, why can't we? My question is why can't we? Like if we were to build our hospital around everybody gets 6 10-minute breaks, like that's your hour lunch for the whole team, then it becomes easy to navigate a system. But if we just throw a wall up and say we can't do it because it sounds like chaos, then we're never going to get to a point where we can appreciate a human being as a human being.
I think that's a message that's so important in VetMed in general. And Vet Tech Kelsey, she reminded me of just how creative we really are in this
Yeah.
field. And so instead of just dismissing it out of hand, lean into that creativity and come together as a team and see what works. And it doesn't have to fit the mold of the way we've always done it.
Yeah. Well, look what COVID did to us. Like we learned how to do procedures curbside. We learned to throw ourselves into telemedicine, which we were resistant for as an industry for so long. Like we can learn how to do the next phase. Like what got us here won't get us to the next phase, right? We can learn how to build our hospitals around inclusivity for whatever that is. My motto is let's treat a human being like a human being, and every human being is different. And it doesn't matter if it's your background, your sex, your gender, your neurotype, none of that matters. If we just speak to the human being in front of us and how it is that they can be a good contributing member of our team.
Absolutely. One of the things I think about for my own situation is, I work full time and have a demanding job that
Hmm.
requires a lot of time and focus and spoons. And my husband, same, he works full time. He also has a demanding job. We have two kids. There's just a lot to managing life, and it is chaos most of the time. And it's so meaningful when I find those moments where I feel like my humanity, my individuality, I'm recognized as a human being, not as be here from this time to this time and that's it, no exceptions. Or, you have to take the hour lunch because that's the only way we do it. But when small what's the word for it, like micro accommodations, or
Hmm.
there's a word that might be the word, are made to just help calm that chaos down a little bit. And ultimately, I'm more productive, I'm more settled. I'm assuming my husband's in the same boat. When those little accommodations can be made that recognize us
Yeah.
as individuals. Of course, within the context of greater businesses and understanding that, businesses have to stay open, clinics have to stay open, they have to see patients, they have to make money, otherwise we can't take care of anybody. So
Yeah.
within reason, but still treating everyone as individuals.
Yeah, I think that the utopia that we see is universal design and accessibility for everyone, no matter what walk of life you come from, no matter what neurotype that you are. The famous example that's out there are curb cuts for handicap, wheelchairs to go up and down a curb. But who else do they serve? It's created accessibility for, parents with strollers. It's allowed us to bike on the sidewalks. It allows us, all different activities and all walks of life can use that without interruption. We don't sit there and go, well, it's unfair that I don't have a step, right? Like universal design says we can create our hospital, we can create our world and our life in a way that suits the wider whole and not just a focused narrow group of people.
Sure, sure. I'm curious, what are some of the other accommodations that you've seen be helpful in the workplace?
Yeah, the number one thing I talk about are breaks. Like I'm legally required to give you a 60-minute break, but no state says that has to be consecutive 60 minutes that I'm aware of. We can break that up and say, you know what, you can have 10 six 10-minute breaks or 10 6-minute breaks or whatever that looks like. It's harder to manage, which is why people don't like to do it. It's harder to make sure that it's happening. One of the things that I did in my hospital, and I had no idea I was doing this, whenever we bought a new hospital, I would take all the doors off of the pharmacy. And what I know now about myself is object permanence. So object permanence is why babies believe that you don't exist when you put your hands in front of your face and play peekaboo. Like they think you vanish from the universe if you put your hands in front of your face. At about 18 months of age, object permanence comes into play. And then they don't realize that you leave the face of this earth. Like you're still there, you're just behind your hands. So in our neurodivergent folks, oftentimes we don't know what's behind a cabinet because we can't see it, or we forget about it because we can't see it. It's not in front of our face. So one of the accessibility things that I created unknowingly at the time was taking the cabinet doors off of the pharmacy, or maybe we put glass doors on. And the reason for that was it helped me with inventory. That because I had a working memory problem of like I didn't remember to order whatever it was, right? That was my ordering system. And what I found was it created accessibility for all because when I had a relief vet come in, they knew exactly what drugs I had to carry and they didn't have to search around and ask for things. They can go, oh, there's your pharmacy. Yep, okay, there's your drugs. I know exactly what I want to prescribe to this patient. So it creates accessibility because it gave me, somebody who's got neurodivergent object permanence, the ability to do my inventory better. And it also helps a variety of my other team realize, oh, here's the group of antibiotics. That must be an antibiotic. You know, it allows them to see what's going on. My relief vets knew what pharmacy I carried. It made efficiency in the practice without even realizing it.
Gosh, so many simple things. The object permanence reminds me of years ago, it's a long time ago, I was complaining to my grandmother that I kept I kept buying bell peppers and then I would put them in the refrigerator and then they would go bad because I would forget they were there because they were in the produce drawer and I would forget to use them. And she looked at me and she said, Cassie, put them on the counter. And I said, well, that's a good idea. And I would like to say never again did I waste a bell pepper, which is not true, but
That's
I
the
got a
dream.
lot
It's called
better about
universal
it.
design.
Sure. Yeah.
Universal design is the dream. A couple others are so for people like me who have light aversion, like I like light is a huge thing for me. Like if you can find a desk lamp for yourself at your desk that can drown out the harsh overhead lights, if those are what bothers you, like the fluorescent lights kill me. Get yourself a desk lamp and drown out that overhead light with a light bulb that works for you. I am a huge fan and advocate for giant headphones or even the ones that you get at the gun range to drown out the sound. And it's not necessarily for sound, but it's like as a visual way of knowing, do not disturb me, I'm working on my charts, right? Accessibility is this has helped me drown out the sound and not be distracted when I'm writing up my charts. But it's a visual representative to everyone else to not bother me while, during that time. So it creates accessibility for all.
Yeah, yeah, absolutely. No, that makes sense. So I'm thinking of someone who it might be like I was a few years ago, or, like you, when you mentioned at the start of COVID, and might be listening to this conversation and say, I can relate to some of this. And I'm wondering if, I might have a particular flavor of neurodivergence and want to explore that a little bit further. What would you say to people who are kind of curious about that within themselves?
Number one, the best thing I did was research as much as I could about the different neurotypes and how did it relate to me. The caveat being just because you read about like let's say you are not diagnosed with ADHD, but you resonate really well with it. Be careful when you're reading the text to not adopt the behaviors that the book talks about. So we don't want to fall into what's called a label loop, where we start displaying behaviors just because we resonate with the diagnosis, because we will not resonate with all parts of it. Not everybody has all signs at all times, or all symptoms. I hate saying that word, but all symptoms at all times. There are things that do not resonate me with ADHD or autism, but it's easy for us as people to fall into behaviors that we think are expected because of the mask that we wore to fit in. We now want to wear that mask to fit into a diagnosis that fits us. And so that's the caveat I put on that. But definitely there are amazing books out there. I love The Canary Code. That's a great book. There's another one. It's by Leanne Maswell. She just came out with one about ADHD. She's a phenomenal author on a bunch of different neurodiversity topics. There is Now It All Makes Sense by Alex Partridge. That's a fantastic book and his journey about how he got his ADHD diagnosis. So read all you can. Be careful what you listen to or watch on TikTok. These are people's lived experiences and not always real, true by the book information. So sometimes that is just one person's experience.
I think that's really good advice because certainly I can relate to what you're saying and not resonating with all aspects of my diagnosis, but certainly the ones that do resonate with me are really helpful. And so
Yeah.
exploring it and understanding it as much as possible, including some of the language, that's been a really enlightening part of talking to you, Ron, is being able to put words to some of the experiences, but not going too far down that path to where now we're manufacturing behaviors from a perfectly understandable place, but not necessarily a helpful one.
Yeah. I'm obviously, as a coach, I'm a huge fan of actually getting coached through that because the mask that we wear, I said it earlier, is we oftentimes lose our identity and finding out who you are. And even in VetMed, we tend to do this as a profession. We lose our identity in our work. And so just as a great thing to find out who you are and what your identity is, I definitely recommend finding coaching. It's vastly different from therapy, which focuses on our traumas and the past. Like coaching is really focused on forward facing. How do we move forward with where we are and what we've been given in the world?
So, Ron, can you talk about that a little bit more? I'm really
Yeah.
interested in what you're saying here about coaching. What should someone expect when they're thinking about coaching?
Yeah, the misperception is it's very similar to therapy. And so I kind of made that distinction. This is more forward facing, goal oriented. A coach is not going to give you advice. A coach is not going to mentor you. They're not going to give you the resources. They are really going to pull the information that is already within you. So the premise coaching, at least for my coaching, is the coachee, the person I'm talking with, my client, is whole and complete in and of themselves. And all I'm there to do is hold up a mirror for when their actions don't match their words and allow them to see that and then pull the information that is already within them because that's why I love it for a neurodiversity standpoint is I want to work with you with how your brain works, not what the book says, not what's expected of you of society, but how does your brain work so that we can work together and I can pull out of you where in your life it has worked well and let's use your experiences on what's worked well to deliver that in areas that are not working well.
Gosh, I'm so glad that we're talking about coaching because it's just not something I would have thought about in terms of, ADHD in my case. And really talking to you here, I can really appreciate the value of taking that mask off and understanding who you are as an individual and then yeah, and then playing to your strengths.
Yeah. Know that it is a hard emotional journey to understand who you are. And just that the grief of who you thought you were really hits home with a lot of my clients.
Wow. Man, I was gonna, kind of ask you a little bit about different tools that can be helpful people who are neurodivergent, but I don't know. Like that seems like such a sharp turn from what we were just talking about.
Yeah, I think coaching is definitely a tool for anyone out there. Be careful, like be specific what you're looking for. Other couple of tools, I have a needs assessment that I would freely give you. I think we can have it available as a download through this podcast. But it basically goes over what are your strengths and weaknesses, getting to understand who you are, what are your sensory needs, how do you work best, and really defining who you are and how you show up at work and then being able to advocate for yourself so that you can figure out what accommodations you actually need to ask for. Is it 6, 10 minute breaks? But we don't know that until we start to break ourselves down and understand where we do our best and how we function the best. I love the tool Goblin Tools. It's in the web browser. It's going to sound like a funky URL, but it's goblin.tools. It is the greatest thing where when a task seems overwhelming and I find myself in executive dysfunction, it's a great place to throw that task into Goblin Tools and it will break it down for me into all of the micro steps because the micro steps do not seem as hard. And then I can then build the momentum to get the tasks done. Have you ever heard the term like eating the frog? Like do that
Yes.
one big task at the beginning of the day and your day will feel accomplished. To me, that's not the neurodivergent way of getting my task done. Like I think Andy Rourke calls it eating the candy, which is let's do the low level task and build the momentum so that we can then eat the frog at the later part of the day. That's who I am at least. So I need the little task. Tell me how to break this down because I think about breaking it down as a whole nother task. But if I can get somebody to break that task down for me, I can get work done because it doesn't seem so hard.
Yeah, yeah, absolutely. I think there's some physiology behind that too, of building up to the harder task after kind of getting the dopamine rewards of accomplishing smaller tasks and breaking it into
Yes.
smaller pieces. Several years ago, I read a book called The 5 a.m. Club, and it was about, you get up at 5 a.m., you do 20 minutes of reflection, 20 minutes of exercise, 20 minutes of learning. And I've kind of followed that model to a point for several years. I'm not super consistent. Like, don't get me wrong. I'm not, like a superhero who gets up at 5 a.m. and does everything perfectly. But more recently, I listened to it was a Jay Shetty podcast, and he had a neuroscientist on there, and he was talking about the way our brain builds up dopamine in the morning and well, just in general, but how, like you said, it can seem impossible to get out of bed and brush your teeth in the morning. And he's like, but think about it. Dopamine comes from doing things that are difficult, and it like you're not supposed to get it all at once. And as a matter of fact, if you do, for example, like if you get up and you look at your phone and you get that big rush of dopamine, your body actually down regulates those receptors. And so
Yes.
you can't, then you're just in a slump after that. So he's like, just get up. It feels Herculean to walk in the bathroom and brush your teeth, but by the time 2 minutes is up, it feels a little bit better. And then like go make your bed, and it seems impossible, but by the time you get there, it's a little bit better. It's this slow build of dopamine over time. I'm curious how that fits into just kind of your knowledge when it comes to neurodivergence. I think he was talking about humans in general, but if there's an application with neurodivergence as well.
I think so. I think the Herculean way of that is more neurotypical. I would say that for me, I try to build the universal design into my life. So I have a harder time brushing my teeth in the morning, and I know that's a problem for me. And actually think I know why now because my bathroom is really cold and I am very sensitive to the temperature. So I
Yeah,
have a lot of hypersensitivity reactions. So I have a toothbrush and a toothpaste separate, a second set in a bathroom downstairs. And so when I use the bathroom in the morning after my coffee, I then brush my teeth. I'm like, great, now I don't have to have the disgusting coffee taste with my toothpaste. And then I have it downstairs where that bathroom is nice and, it has a different temperature, it's more ambient, and I don't feel so disengaged. I'm already going to the bathroom and then I can just do the thing. So if we can have it stack in a way that puts the activation energy in front of us. So one of the things I do is I throw my phone onto my bed in the mornings so that it will, not always, but it will prompt me to make my bed. Right? So it's like if I throw it under a cover, I have to move the cover to get to my phone, which then it was like, well, I have the covers in my hand, I might as well make my bed. But
makes
if I have
sense.
to think about the thought of making my bed and then how many steps it's going to take me to make my bed, that's overwhelming. Feels like Mount Everest. I'm never going to make my bed and I'm going to avoid, avoid, avoid. But if I can create the steps where it's like, all right, I'm going to throw my bed in my phone, bury it in there, and then that will force me to do this thing, which then I already have in my hand. Then I already have the energy to do it. I don't have to think about. I think that's the big thing is having to think about all the steps it takes you to do a task. But I do this trick when I do speaking. It's like I ask who is a neurotypical in the room, how many steps does it take you to take a shower? And most people are like 7 to 10 steps. And then I start going off and I'm like, I'm in 35 steps before I even like got into the shower. And it's like that's the difference of our brain has to process every micro step. And so if I can take some of that brain processing away so that a task feels smaller, it's a lot easier to do the task.
So that's interesting. Before, we were kind of talking about breaking down bigger tasks into smaller steps to make them feel
Mhm.
more manageable. But it sounds like what you're saying here, which I can totally relate to, is in some cases that's actually working against you. And taking a different strategy like habit stacking is more effective, and it kind of eliminates some of those steps and makes it a little bit easier.
Yeah, so like the habit stacking is not a universal way of how to work with your brain. It's one way when you don't know where to start because there's so many things to think about. So it's like, what's the next one little thing that I can do when I don't have to spend the brain power to think of the 120? The other part of that is when something is 150 tasks, like habit stacking doesn't matter because it's overwhelming to even start
Right. Right. That makes sense. So yeah, knowing kind of how to apply
and
each type
when.
of technique and when.
That's why it's like
Absolutely.
super individual by the person, which is what
Yeah.
I love about the coaching, because then I can work with that individual instead of making these broad, assumptions or teachings about this is how you work with people's brains, because there's no way to do that.
And but thinking about that and working with each individual, because I realized I don't know that I ever made the connection between the 5 a.m. routine and the dopamine thing. It more so it drew this like physiological line for me of like why this potentially works for me. So for me, like getting through and doing that, I continuously tell myself I'm like this sucks, and I'm like it's not supposed to be easy. It's not supposed to be easy, and that kind of gets me through. And that, but again, that's what works for me. And I think you brought up something totally different to say, well, I'm really temperature sensitive. And so that's not going to work for me because no matter how okay I am with the fact that this feels like a really hard task, it's still cold in there. And so being
Yeah.
aware of, yeah, each individual and I think that really circles around well to the coaching that you're talking about and understanding yourself as an individual.
Yeah, it's so rewarding when I work with a client and they're like, "Oh, this is why it's so hard. If I just had known to work with myself this way." It's like that's the rewarding part. It's getting them to light up about like doing things and feeling quote unquote normal again.
Absolutely. And then hopefully you mentioned that you have a son. I've talked about my daughter being one of the reasons that I pursued a diagnosis. So hopefully bringing that back around to our kids and helping them not feel like they have to mask in the
Yeah.
same ways that we did.
Yeah, like it's hard. I don't know about you and your daughter, but like me and my son, I have two sons, both ADHD, and they our neurodivergence clashes all the time. Like I am a person who's sensitive to I'm sorry, to sounds and light, and they're like the loud and yell, like they don't have inside voices. They just know loud is like volume 10 is their norm and that's their baseline. And so there's a lot of clashing. And there was a great book I recently called Calming the Chaos, which is done by an ADHD mom on how to like work with her kids' neurodivergence, which is a fantastic book to read. But that's what happens in my household is our neurodivergence clashes. Like it's not always just because we're two neurodivergent people doesn't mean we're going to get along. And so sometimes your stimming is also my hypersensitivity. And so we working through that with my kids, it's been a journey of
Sure,
not wanting
but
to be that parent that shuts it down and be
mhm.
show them why I'm doing what I'm doing and being inclusive. So hopefully they can get that framework and that baseline to look at other people the same way.
Absolutely. Absolutely. Because yeah, just thinking of having that awareness and being able to say this is what's happening in this moment right now and then, figure out how to make it work rather than my kids are loud and it makes me upset all the time. Really understanding the nuance to it. I think I hope it sets I have two daughters. So all of our kids up for success in the future.
Yeah.
Well, Ron, I could sit here and talk to you for the rest of the afternoon, and I will if you let me. But I do want to be
I love
sensitive
it.
to your time. So thank you so much for joining me. Is there anything that we missed that we didn't cover?
I think that's a really good roundabout way of talking about what the clinics need. A big thing on universal design, and yeah, I think we covered a lot of great work. And if there's anything you ever want to cover, like in more detail in the future, please, I'd love to come back and talk about it.
I be careful. I will take you up on that. I don't even know what to say at the end of that episode. It was such a great talk that just I enjoyed personally. So I really hope to all of you tuning in that you enjoyed it as much as I did. Ron, thank you so much for joining me. I really, really do hope we get the chance to do it again sometime. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts to help other veterinary professionals like you find this and other great content we try to put out there. If you'd like to hear more episodes, you can find us wherever you get your podcasts or click on the Education tab on the VetFolio website. And of course, we'd love to hear your input on this episode as well as ideas for what you'd like to hear from us in the future. So absolutely reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM, or you can find me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.